Hello everyone, now let us discuss about anatomy of knee joint. Now coming to knee joint, it is the largest and most complex joint of the body. It is called as tibiofemoral joint. It is a modified hinge joint because its primary moment is uniaxial hinge moment and consists of three joints within a single synovial cavity. Knee joint consists of three joints within a single synovial cavity and it is a modified hinge joint. Laterally is a tibiofemoral joint. What are the three joints? Laterally is a tibiofemoral joint between the lateral condyle of the femur, lateral meniscus and lateral condyle of the tibia, which is the weight bearing bone of the leg. Tibia is the weight-bearing bone of the leg. Medially is another tibiofemoral joint, lateral tibiofemoral joint and medial tibiofemoral joint between the medial condyle of the femur, medial meniscus and medial condyle of tibia. The lateral tibiofemoral joint is between the lateral condyle of the femur, lateral meniscus and lateral condyle of tibia. And similarly, the medial joint is between the medial condyle of the femur, medial meniscus and medial condyle of the tibia. An intermediate patellofemoral joint is between patella and the patellar surface of the femur. Intermediate joint is a patellofemoral joint that is between the patella and patellar surface of the femur. Now coming to the anatomical components, the first one is articular capsule. Independent capsule unites the bones of the knee joint. The ligamentous sheet surrounding the joint consists mostly of muscle tendons or their expansions. There are, however, some capsular fibers connecting the articulating bones. The next is medial and lateral patellar retinacula. Fused tendons of insertion of the quadriceps femoralis muscle and the fascia lata, that is fascia of thigh, that strengthen the anterior surface of the joint. The next is patellar ligament. Continuation of common tendon of insertion of quadriceps femoralis muscle that extends from the patella to the tibial tuberosity also strengthens the anterior surface of the joint. Posterior surface of the ligament is separated from the synovial membrane of the joint by a infrapatellar fat pad. The next is oblique popliteal ligament. It is broad flat ligament that extends from the intercondylar fossa and lateral condyle of the femur to the head and medial condyle of the tibia. The ligament strengthens the posterior surface of the joint. Patellar ligament strengthens the anterior surface of the joint, whereas oblique popliteal ligament strengthens the posterior surface of the joint. The next is arcuate popliteal ligament. It extends from the lateral condyle of femur to styloid process of the head of the fibula. It strengthens the lower lateral part of the posterior surface of the joint. The next ligament is tibial collateral ligament. It is a broad flat ligament on the medial surface of the joint that extends from the medial condyle of the femur to the medial condyle of the tibia. Tendons of the sartorius, gracilis and semitendinous muscles, all of which strengthen the medial aspect of the joint, cross the ligament. And tibia collateral ligament is firmly attached to medial meniscus. The tibia collateral ligament is firmly attached to medial meniscus. The next is fibrous collateral ligament, a strong rounded ligament on the lateral surface of the joint that extends from the lateral condyle of the femur to the lateral side of the head of the femur. It strengthens the lateral aspect of the joint. The ligament is covered by tendon of biceps femoralis and the tendon of popliteal muscle is deep to the ligament. The next are intracapsular ligaments. The ligaments within the capsule connecting the tibia and femur. The anterior and posterior cruciate ligaments. are named based on their origins relative to the intercondylar area of the tibia. From their origins, they cross on their way to their destinations on the femur. The next is anterior cruciate ligament, ACL. Anterior cruciate ligament, it extends posteriorly and laterally from a point anterior to the intercondylar area of the tibia to the posterior part of the medial surface of the lateral condyle of the femur. The ACL limits the hyperextension of the knee. Anterior cruciate ligament limits the hyperextension of the knee, which normally does not occur at this joint, and prevents the anterior sliding of the tibia on the femur. The ligament is stretched or torn in about 70% of all serious knee injuries. Anterior cruciate ligament is the most susceptible ligament, and it is stretched or torn in 70% of all serious knee injuries. ACL injuries are much more common in females than males, perhaps as much as 3 to 6 times. The reasons are unclear, but may be related to less space between the femoral condyle in females, so that the space of ACL movement is limited. The next reason is the wider pelvis of females that create a greater angle between the femur and the tibia. The wider pelvis of the females, it creates a greater angle between the femur and tibia and increases the risk for an ACL tear. Female hormones that allow for greater flexibility of ligaments, muscles and tendons, but which do not permit them to absorb the stresses put on them, thus transferring the stresses to the ACL. And the female's lesser muscle strength causing them to rely more on the ACL to hold the knee in place. These are some of the reasons why the ACL injuries are more common in females than in males. The next ligament is posterior cruciate ligament, PCL. It extends anteriorly and medially from a depression on the posterior intercondylar area of the tibia and lateral meniscus to anterior part of the lateral surface of the medial condyle of the femur. The posterior cruciate ligament prevents the posterior sliding of the tibia. Anterior ligament prevents the anterior sliding of the tibia when the knee is flexed. This is very important when walking downstairs or a steep incline. Posterior cruciate ligament is very important when we are walking down the stairs or a steep incline. The next is articular discs, which are nothing but meniscus. Two fibrocartilage discs between the tibia and femoral condyles help compensate for an irregular shape of the bones and circulate the synovial fluid. Now, these meniscus, the articular discs or menisci, they are divided into various types. The first one is medial meniscus. Meniscus is nothing but articular discs. These are the two fibrous discs between the tibia, fibrocartilage discs between the tibia and femoral condyle that help compensate for irregular shape of the bone and circulate the synovial fluid. First of all, coming to medial meniscus. Semicircular piece of fibrocartilage that is C-shaped. Its anterior end is attached to the anterior intercondylar fossa of the tibia and anterior to the anterior cruciate ligament. Medial meniscus is anterior to anterior cruciate ligament. Its posterior end is attached to the posterior intercondylar fossa of the tibia between the attachments of the posterior cruciate ligament and lateral meniscus. Now coming to lateral meniscus. Nearly circular piece of fibrocartilage. That is, it approaches an incomplete O in shape. Its anterior end is attached anteriorly to the intercondylar eminence of the tibia and laterally and posteriorly to the anterior cruciate ligament. And its posterior end is attached posteriorly to the intercondylar eminence of the tibia and anteriorly to the anterior end of the medial meniscus. The anterior surfaces of the medial and lateral menisci are connected to each other by transverse ligament of the knee. The lateral meniscus and medial meniscus, the anterior surfaces of the lateral meniscus and the medial meniscus are connected to each other by the transverse ligament of the knee and to the margins of the head of the tibia by coronary ligaments. The next anatomical component is the more important bursae of knee include the following. Bursa. Pre-patellar bursa between patella and skin. Infrapatellar bursa between superior part of tibia and patellar ligament. And suprapatellar bursa between inferior part of femur and deep surface of the quadriceps femoralis muscle. Here you can see this is the knee joint, right knee tibiofemoral joint. Knee joint is the largest and most complex joint of the body. This is the patellar surface of the femur. This one is the lateral condyle of femur. And this ligament is the anterior cruciate ligament. And this is the medial condyle of the femur. This is the lateral condyle and this is the medial condyle of the femur. This is the anterior cruciate ligament and this one behind it is the posterior cruciate ligament. And this thing is the lateral meniscus. This is the articular disc. Lateral meniscus. And this one is the medial meniscus. Next is this one. This is the fibrocollateral ligament. Fibrocollateral ligament. And this ligament is the anterior ligament of head of the femur. And this one is the transverse ligament of the knee. The lateral meniscus and the medial meniscus are attached together by the transverse ligament of the knee. This one is the tibial tuberosity and here is the tibial collateral ligament. This bone is fibula and this bone is tibia. This is the superior view of the meniscus. Here you can see this is the patellar ligament and this part is the anterior cruciate ligament. And this thing is the medial meniscus and this thing is the lateral meniscus. And this is the posterior cruciate ligament. Now here you can see the bursa. This is the suprapatellar bursa. And here is the prepatellar bursa. And this one is the infrapatellar bursa. See here, this is the prepatellar bursa, this is the suprapatellar bursa, and this is the infrapatellar bursa. This one is the patellar ligament, and this thing is the infrapatellar fat pad. And this is the patella. This bone is femur, and this is tibia. Coming to the movements that are allowed by the knee joint. The knee joint allows flexion, extension, slight medial rotation, lateral rotation of the leg in a flexed position. These are the various movements that are allowed by the knee joint. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.